Well, hello, everyone. Welcome to another live guest interview within Mindful Journey. We're so excited to have you here today and grateful for your continued participation and engagement. I'm delighted to bring you our guest today. As many of you, like we just heard, he requested he be called Peter, but Dr. Pronovost, Peter Pronovost, is quite well known in the world of medicine and has made significant contributions. But even just what you may have found from him, his humility, which I've experienced from afar, although have not formally met, is what drew me to his work. He has a podcast currently, which is called Micro Moments. It's centered around love. I first became familiar with his work through a book by another author that noted his checklists, and that is particularly what his work today may be so well known for, although he has many other accolades and awards. The scientific work leveraging checklist was designed really to decrease the and reduce catheter-related bloodstream infections. And I'm sure we'll dive into that a little bit. Today, he's currently the Chief Quality and Clinical Transformation Officer at University Hospitals. And I could go on and on through his resume again, but I think what you'll find in conversation is his deep desire to serve people, to care for others, and has a overwhelming why, at least from my vantage point. So, Peter, thanks for the work you're doing in the world first and foremost, and thanks for being with us here today.
Thank you for having me.
Certainly. Would you mind giving just a high-level overview of what your work today at University Hospitals looks like and what led you into the world of medicine?
Yeah, Adams, it's really exciting and both hopeful and uh, humbling. Uh, at University Hospitals, I serve as the Chief Quality and Clinical Transformation Officer. So that's a bunch of jargon, meaning I oversee all of quality and safety and patient experience and regulatory uh, everywhere we're delivered in our 25 hospitals, 55 ambulatory sites. I oversee our ACO. We have about 700,000 lives where we're responsible for the cost of those patients and the quality of patients, and have contracts that if our cost is below the threshold, we receive some benefit. It's above, we pay. And then I oversee the entire care management, social work or physical therapy, home health teams that work together to solve hospital problems and the ACO problem. So it's a really neat model. What we did, Adam, is out of necessity, because with COVID, we really struggled as hospital systems. Post-COVID, our labor costs were up exceptionally high. To give you a feeling, we went from spending, maybe 300,000 a month for premium labor, meaning nurses or other staff who we get contracts with outside agencies, to about 18 million a month, right? And no higher revenue. So we had to just absorb that. So in the midst of this challenge of losing money, we made cuts like every hospital did, but we realized it wasn't enough. They weren't going to get us to where we need to be, to the promised land. And so we took much of what I learned over decades doing this work, as you know, Adam, about what worked, what was the secret sauce, and packaged it together in a model of organizational transformation that we call living and leading with love. And so that may sound hokey, but let me be really crystal clear what we mean. By love, we mean the energy that is within and connects us all. We're born with it. You don't need to do anything to deserve it. And it means that we see people, all of our employees, as worthy and capable. And when you bring worthy, capable people together, you solve problems better, faster, cheaper. Innovation and learning flourish, and joy just blossoms. I mean, it's literally that simple. Now, how do we operationalize that? Because every health system in America says, I need to transform. But the reality is, you go deeper and look, okay, what does that mean for you? Like, it's a great word, but how do you operationalize it? So our operational view of this was, we brought together, Adam, three theories or concepts that are well developed in the literature or leadership and management literature, but have just simply never been packaged. The first is what we call believe, That is, make sure every one of our employees sees that it's their job to improve value and that they feel inspired and unleashed to do it.
Mm.
When we first started this, Adam, I'll share a quick story. Back in 21, we asked every role in our organization, it took a while, what do you need to stop believing and start believing for it to be true that value is your job and you're inspired? And what was
Wow.
stunning, yeah, really humble, right? Think about
Powerful.
the humility.
Yeah.
Every role and virtually every person in every role gave the same answer: the lack of love. Or if we say love is the energy that connects us, separation is the absence of love. And every message was something like this, Adam: I'm going to stop believing that my voice doesn't matter. I'm going to stop believing that I don't count. I'm going to stop believing that I'm just or fill in the blank. And this was, EVS, transport, but also doctors, nurses, executives. And I'm going to start believing that if I speak up, I can make change. I'm going to stop
Mm.
believing that I matter. Right? I mean, so you see this lack of love, and the literature says 80% of people in healthcare aren't connected to their, to their organizational purpose. But we know when supervisor level and below connect to their purpose, to the organization's purpose, it performs 50 or 66% better on every measure. So we knew we need to change that. So we started training our leaders and managers on making sure everybody is unleashed and inspired, that we evolve away from command and control. And we did this discussion, Adam, which about 1,000 leaders in the room. And I shared the story, a true story, where if you put a flea in a jar, it will immediately jump out. They don't like being constrained, like we don't. If I put a lid on that jar, it'll bonk its head twice, but then it learns not to jump any higher, so it stops hitting its head. But when you take that lid off, the flea will never jump out again. We've conditioned them not to aim
Wow.
high, right?
Yeah.
And so I put a picture of that up and I said to you, how many of you feel like a flea in a jar? And literally every hand went up. And I wrote a blog on this. I'm like, okay, why are we wasting this energy and love? You have ideas, like unleash your teams. They're beautiful. They're brilliant. Like, yes, it's messy, but that's how we're going to solve this problem and get our costs out. I mean, and everyone was like energizing for people, Adam. They're like, wow, like, I get it. I don't need to command and control. We said, no. Your job as leaders is to clarify why we're doing something and what the goal is, and keep our paws off of how. How is the people closest to the work. And
Mm.
I'll never forget. I got an email after I wrote this blog from a nurse practitioner. She sent it like 12:30 at night. She said, Peter, I don't know you, but I read your blog and I was in the audience when you're talking, and what you said touched me because I'm that flea in the jar.
Mm.
And she said, when I was a nurse, I felt like I had my people and I, somewhat could do things, but not often. I still was a flea. But now that I'm an NP, I don't really connect to the nurses. I don't really connect to the docs, and I don't have a home.
Mm.
And part of our transformation meetings, we have a meeting every Tuesday morning at 8. We call the Illuminators, based on David Brooks' book, How to Know a Person. They're people who connect, elevate, and improve. And I said, well, now you're Illuminator. Show up, come here every Tuesday morning if you want. You have a home. But so it was beautiful. This year, we wanted to understand that same approach. But I sensed culture change. So instead of saying, what do you need to start believing, I just asked, how did you move the needle? Because I sensed they
Mm.
were involved in projects.
Yeah.
And I walked around, Adam, truly unbelievable. An EVS worker in one unit says, Dr. Peter, I want to show what I'm doing. My job is to prevent infections. And I'm like, okay, you're after my heart. So what are you doing? He's like, every day I know that how I clean this room matters to patients and it helps prevent infections. And for the first time, the leaders are sharing with me the scores that we get from, CMS requires to us, how clean the room is. I track it every week and I go home and put it on my refrigerator, and my kids now know what I do. They used to say
Wow.
I was an EVS worker. They now know I'm part of the safety team. And I'm passionate about it. I'm like, I literally gave me chills at him. I went into another unit and one of the transport people were there. And so we're saying, how do you move the needle? She's like, I relieve people's suffering. And I said, tell me, I'm
Mm,
sure you do. Well, I know when I go to pick up someone and transport them, they're nervous. They don't know what's going on. And I sense that. So I just tell them it's going to be safe. And I ask them what's bothering them. And they talk and I try to comfort them. And I realize that when I go in their hospital room, that's like their home. And I have to treat that as a sacred space and honor it. So I don't move
mm,
things around or mess it up because people, and I don't know if you ever like been hospitalized or people, like it is like your little sanctuary.
mm.
And she said, so I honor them, I honor the space, and I know that I could relieve their suffering, sometimes by laughing, but by being sensitive and compassionate to their needs. Then, Adam, a third
Mhm.
story in this domain, so cool. So we trying to reduce blood clots in the hospitals. And, a big cause of them is we put people on these squeezy boots, compression devices that move pressure around your legs so you don't get blood clot. But they require to be air hoses to be connected. And people are tethered to them. So if you get up to move around or go to the bathroom, you have to disconnect them, and there's no signal that says if they're disconnected. So as you can imagine, in America, about half the time they're not connected. It's a
Mhm.
stupid, flawed design.
Mhm.
So some of the nurses in our units were innovating. We're saying, how do we get to zero harm? And they found these wireless compression devices that don't need the connection. There's a battery pack, but it requires a new job. Somebody every day has to ensure the batteries are charged, and that if they're not charged, they're replaced. And as you probably know, Adam, in any organization, when you add new work, it's like the hot potato. Who's going to change the batteries? I can't do it. I'm too busy. Right? That's like the self-centered culture, not the patient-centered culture. So
Mm, mm.
I go up to this unit. They're telling me about this project, and the unit secretary, right, a short woman comes up and she's literally jumping down in front of me and she's like, Dr. Peter, I want to tell you how I'm part of the safety team and I prevent blood clots. And I said, tell me, what are you doing? She said, every morning I come in at 7 a.m. and my job is to go test every battery's charge. And if
Wow.
it's not charged or it's low, I replace it. So I make sure these people don't get blood clots, right? And I'm just blown away. I'm like, okay, that's living and leading with love. So
Yes.
the second operational part of it, the first part was believe. The second part is belong. And it's based on the data, Adam, that we know innovation and learning flourish when you have a structure that allows the free flow of ideas and a culture that allows people to speak up without, whether your pedigree is a doctor or some fancy title. There's no requirements. It's just we trust you're worthy and capable. But as you know,
Mhm.
that doesn't happen. We have silos and we can't break out of them, and innovation doesn't flourish, and or the culture is wrong. And so we again shared this story of that we need to be bluebirds and not robins. And
Mm.
the story is, if you have ever seen Mary Poppins or your audience has seen it, in the background throughout the whole movie or play is birds chirping when she's flying down, when she's skipping. And that's because London in the late 40s was full of two types of melodious songbirds, the red robins and the bluebirds. And they used to peck through the tops of the milk containers that were left on people's stoops. They sucked the fat out and they were chubby, happy birds that sang a lot. But then the milk companies changed the containers from cardboard and steeple to aluminum and flat. And both birds are equally smart. And a few of both birds learned the new way to peck. They have to tuck their beak. But the robins are extinct today, and the bluebirds thrive. And the only difference is the robins are solitary birds. They have their stoop or their corner. We may call it our role, our department, our division, and that wisdom never separated. The
Mm.
bluebirds are flocking birds and they fly strong and proud together, and the wisdom quickly disseminated. So we said we need to be an organization of bluebirds, not red robins, and we need ideas to just flow freely because almost every problem we're solving somewhere in our organization, someone's hitting it out of the park and they know how to do it. We just
Mhm.
don't get the idea. Just like if you look at all the great restaurants or chefs today, are this diversity of I grew up in Japan, trained in Stockholm, opened my first restaurant in Paris, and now I'm in New Orleans doing Cajun, and they bring it all together, and it's beautiful and messy and majestic. But like that's how we innovate, right? We get these different
Mm.
diverse ideas or forms to meet, mate, multiply, and poof, you get a solution. The third
Yes.
part of this is building discipline management and shared accountability. There's great data from Nick Bloom that looked at management across health systems in the globe, including in the US, and concluded, good management is almost entirely absent and it really matters. And accountability is entirely absent. And so in all of our projects now, these aren't just soft stuff. We say, you have a management system. If you could show me at a system level a run chart with a slope other than zero of a measure that matters to patients or the organization. If you don't have that, let's go back and figure out because it's probably not clarity about what tasks you should be doing.
Mhm.
Second, you have an accountability system or what we call shared accountability. If you stratify that measure by hospital, by clinic, by individual clinician, and those doing well, you publicly praise and learn from, and those struggling, you silently or in private support and coach. And when we put this together, Adam, the results are breathtaking. You just surgical length of stay going from 6 days to 2, sepsis mortality down by 80%, literally over like 400 things, Medicare costs down by 30%, uh,
Wow.
shared savings going from 4 million to 60 million, having the second lowest or first lowest ACO in the country, winning the American Hospital Association Quest for Quality Award. I mean, it's just on and on. There's an article about this coming out in the Sloan Management Journal in July. I'll make sure you get, but it is the most powerful thing I've ever done in my life, Adam. I mean, it is like I call it the path to proven performance because when you bring this living and leading with love together, it's almost foolproof.
Wow. Peter, there's so much to unpack. First of all, I love your passion for this. And I think more than anything else, when your team feels that, right, it's easy to want to rally around. And again, there's so many ways I could take this, but what I'm pulling from what you're saying is you've not only given people permission to be their authentic self and shared the creativity that they innately have and the intelligence they innately have, but you simplified it of sorts. And that I want to go back to the checklist because I was so intrigued by that. As somebody who doesn't operate in medicine, right? I'm a nerd for it to some extent. I've read a lot of books on it because the fallibility of human behavior in that world when, it's life and death, literally. Yet the people who are operating, who are performing, are dealing with human things too, at home, etc. And when you first introduced that checklist, from what I recall, but it's been a while since I read it about it, but it was five simple things like wash your hands, put a sterile drape over the patient, clean the infected area. And you got a lot of pushback from, doctors, right? Because these are folks who, societally speaking, may be looked at as, high performers who are, quite competent and they've got these fancy degrees and designations. And yet you found that, scientifically speaking, that when they're not doing one or two steps of that list, patients were dying. And my question to you is, I want to, if we can tie in both worlds, how have you been able to push through the inherent barriers that are there by big egoic personalities when you're introducing something that seems so simple? Because in living and leading with love, some folks might view, I love it, hence why you probably took the opportunity to connect mindful journey. That's what we're all about is love.
Correct.
But it's not lost on me that there are people who and I think one of your recent podcasts said this isn't the soft stuff, this is the essential stuff. My long-winded question to conclude is how do you get believers out of non-believers?
Right. Yeah. So let me tell that through the story of the checklist, how it came about. And that story came about when an adorable little 18-month-old girl, Josie King, died of a catheter infection, which led to sepsis and poor teamwork. And she looked hauntingly like my daughter, was born days apart, and ironically, Adam died on my birthday. I
Mm.
learned that after working. The mother was, quite upset, understandably, and heard that I was doing work in safety at this time at Johns Hopkins. So she asked to meet with me, and she looked me in the eye and said, "Could you tell me that this won't happen to my other daughters?" And Adam, I tell you, I had a moral moment because, as you know, as leaders or executives, we always got to give the party line, or we feel we have to give the party line. And so, the normal instinct was all the great things we're doing. And I paused for a second and just drew on my inner strength and said, and her name was Sorrel. Sorrel, I can't tell you that now. Our rates are sky high. We don't have a great program, uh, but I will. I promise you I will. And so we went to the Centers for Disease Control that had a guideline that was scholarly and evidence-based and useless because useless at the bedside because it was 150 pages long. It told us 95 things we can do. It didn't prioritize what's most important. I think about how naive that is or what the risks are. So I just literally went through and said, okay, I'm going to rate them on which things have the biggest impact. My nerdy, it's called the number needed to treat. How many people do I have to treat to prevent an infection? And then which ones are low barrier to use? Picked out those 5 things, as you said, measured it, and we were doing them 30% of the time. And
Wow.
so I said, we're going to aim for 0. And I got such big pushback because the mind was like, well, we're a great institution. We're at the CDC average. And it's a really good lesson for your listeners. When benchmarks are based on broken processes, they anchor you to poor performance, right? Because if you're only doing
Mm.
what you should 30%, we don't know how good we can get. But don't use that as a crutch. And
Yes.
what I realized at the time, Adam, is the culture in medicine told a narrative that harm is inevitable rather than preventable.
Mm.
And in other words, they told a story that when you care for sick people or old or very young, sometimes little girls are going to die.
Mm.
And I didn't believe it. So what I said to them is, okay, you may not know we can get to 0, think I'm freaking delusional, which I may be, but let's do this. Do you agree that these 5 items are evidence-based? We should do them. Yes, Peter, they're all really strong. Okay, then let me be really clear. We're going to measure if we do them, and let's get up to 100%, right? And opting out's not an option. If you don't agree with the evidence, let's talk about it, but you just told me you did. So if a nurse goes to check you doing that and you give them shit and say, I can't do this, they're going to page me and you're going to have to do it. This isn't optional because
Yes.
harm isn't optional. And so
Hmm.
we very quickly put this in. Infections went to 0 at Johns Hopkins, literally 0. We spread this first to the state of Michigan, and we published that in New England Journal of Medicine that they were down by 70% within 6 months. I mean, literally the whole state. And then through a series of federal funds, philanthropic money, we spread it state by state across the whole US. And infections down, or at least before COVID, they went up a little bit in COVID. We're down by 80% in the whole US. And there were examples of having to have, love is strong, love isn't weak. Love demands accountability, having accountability discussions. In other words, love is powerful enough for you to be in the spotlight and shine what you do well, and under the spotlight to say this isn't good. Like when we were starting, the federal government measured infections 5 different ways, and they all had different inferences about how big the problem was and how many people had infections and whether it's getting better or worse. So as a clinician, my head was spinning, like, who do I believe? There's no way you could lead a national project. And so we met with them, broker, to say, okay, the CDC's definition is the best. We're going to use this, or it's their choice, but we got to use this to measure infections. Other branches like AHRQ, okay, you can measure air reports. That's your sweet spot. You have to have something that wins. But at the end of the day, we need one valid measure to track as a country. And so, I mean, it was just remarkable, the journey. And, Adam, as you could imagine, spreading this state by state, you learned to realize the power of informal authority because none of these people report to me. We weren't paying them. The grants weren't that big. It was inspiring them or helping them be aligned. And, I realized at that point and it's an important message for your listeners. The only thing that formal authority allows you to do is call a meeting and pick up the check after dinner.
Mm.
Nobody follows you for formal authority. They follow you because they trust that you're carrying in comp. They trust your purpose,
Wow.
right? And so part of my Kevlar, not part of like, from then and today is this isn't about me. There's no hidden agenda. Like I wasn't trying to sell anything. It was about preventing harm. It was making sure I could look that little girl's mother in the eye and tell her her other daughters will not die. And so and someone pushed back, I'm like, okay, like, sure, give me shit. But unless you have a better way to do this, like we're killing people, you're killing people at your hospital. Like you might as well use this. It's free. But then also, there's this notion that I live by, hire and fire by, Adam, is that change progresses at the speed of trust. And trust grows when we do things with rather than to people. So when we
Mm-hmm.
were spreading this, this was never called the Peter checklist or the Hopkins checklist. I intentionally said, do not call it that. You'll destroy it. You're smarter, make it better, make it your own. Use these 5 things because we know they work, but add to them. You want to take some else, you want to make pretty art on the front, whatever the heck you want to do, make it your own. So, like, there's 5,000 versions of these checklists across America. They're 95, maybe 98% the same, but that 2% difference is what made it work because everyone saw it as their own, and it was perfect for their organization. Like that's that. But being comfortable with that mess is often hard for researchers.
Yes, yes. I love that you said trust, and I'm paraphrasing now because I don't remember specific, but trust is really built when it's with and not to.
That's
And
exactly right.
and I really, I believe all industries could benefit from that because whether it be law enforcement, healthcare, insurance, so many times the loudest voice wins, right? And therefore the people who have these ideas, once something's implemented, they're not fully in it because it's to you did something to me and not with me.
Yeah, there's no buy-in. I
Yes.
mean, and just there's pretty compelling data in almost um, every industry that when leaders, rather than clarifying why and what, but jump to how, use this checklist which is the norm. They're um, almost always wrong about what works because they're not close to it. They're almost never implemented because people just smile and wave and like, yeah, okay, Peter, good try. And if they do, they never work. I mean, like that is the most dysfunctional thing. But I think it's based on when I go the absence of love of separation is when you see people as worthy and capable, why would you ever do that? Because you realize the people closest to the work know a heck of a lot more than me who's far away. Like I got to manage the why and make sure we deliver the goals and honor their wisdom. And it's too often that's not the norm.
So true. Well, I'd like to tie this a little bit back to your personal life, as I think I told you in advance. One of the things that we're trying to do in Mindful Journey is humanize and normalize this shared experience of life that we're all on. And inevitably we all face challenges, hardships, etc. Yet societally speaking, with the overindulgence in social media that's present, I believe social media is a good thing, but folks will compare themselves to others because of that, and it's all generations. It used to be just, oh, it's only the millennial generation, it's only this generation. But you go to an airport now and you're sitting in the area, you've got 80-year-olds on their phones looking down. Everyone is attached to devices. And with that, I think it's inherent in us to look elsewhere and think that somebody's got it better, that they've got the perfect life. And so I'm teeing this up for you because in midst of all that you've done, because quite frankly, people can look to you and say, Peter was named one of the most 100 influential people in the world. He's got it all together. He doesn't face hardship. And to your level of comfort, Peter, I'd like to learn from you. What do you do when hardship arises? And particularly, again, to your level of comfort, what's the most challenging thing that you've gone through in your life? And what do you recall having done to get through it?
Yeah, and I'll share with you a couple of examples because there certainly are plenty of them. Um, uh, One was when I was a fourth year medical student at Hopkins. My father died of a misdiagnosis. It's what got me into safety, and I was going to have to drop out of school because I couldn't afford it. I couldn't get any other additional loans, and I wouldn't be able to work because the demands of that to pay for it. And one a senior physician on the admissions committee, um, who originally told me I shouldn't let you into Hopkins because you didn't go to an Ivy League school. And I said to him, like, I said, well, the only objective test is our MCATs, and I scored 99.9%. So if you believe in science, then you'll let me in. But you need to choose what you believe in. Right? It was a little bold, but when I went to him and said I got to drop out, he showed compassion and waived tuition. Right? I mean, just as a demonstration of how we could rely on others in our times of suffering because the world is generally good. I mean, like I wasn't even going to go talk to him. Um, One of the really hard things, Adam, and I still feel it now, is maybe you could call it like the imposter syndrome, where every level I went to, I felt like I didn't belong there, like I wasn't good enough to be at that level. And then when I started, having success at safety, like many people, literally almost around the globe, like looking, Peter, well, how do we solve this? What are we going to do? And I was like, I don't have any clue, and I felt like, you ever see those cartoons where you're shot out of a cannon and your legs are flailing, right? I literally felt that was like my life for years. I even, sometimes still in these new projects where I think if people have expectations that you perform, you solve problems, like you scale problems across the world. And yet the reality is I'm making it up as we go along, right? Like there's no, and getting comfortable with my legs flailing, because it was terrifying when like that I was thrown out there and saying I'm an imposter. Like, do I just say I can't do it? And why I go back to my theory of living and leading with love, what I kept coming back to is to say I don't need to have the answers. That's not what leadership does. What I need to have is the courage to ask the hard questions and the commitment to bring diverse people together to figure it out. I.e., love, right? And once I had that, Adam, it was so comforting, right? Because I get out of this idea that I have to always know the answer. And we all think, or there is even a single right answer. And saying, no, like the community, we'll figure it out. I got to say, okay, it's not okay that little girls die of infections. Like we're going to figure that out together.
Yes.
I don't have the answers. I think for my own personal journey, Adam, I'm very, very much into well-being, and my well-being focuses on, I would have these like 5 pillars. So, healthy eating, mostly plant-based and non-processed foods, movement. So, like doing weight or resistance training, mobility, hit and running, most days of the week, of stress reduction. And we'll talk about that, some mindfulness, and then making sure I get sleep, social connections, and then like wellness checkups. So making sure I do, especially for men who don't do primary care visits, the mindfulness work, I've really been influenced by a lot of Buddhist teachings, especially Thich Nhat Hanh, or who others. And some of the meditations I will do is that breathing in, I have compassion for myself. Breathing
I
out,
love
I
that.
have compassion and love for the world. Right,
I
and
love that.
it's a great way of like taking care of myself and connecting to the world. I also, Adam, and it's hard because we're always like we're auditioning all the time with social media, right? I mean, that's like when you see people walking around and taking videos of their life, they're not living; they're auditioning, right? And
Yeah.
the pressure for that is enormous. And and in an academics, that form of auditioning wasn't social media, but it was grants, papers, or prestige, whatever. It was still the same damn thing. and it's dysfunctional, and it draws you in, and it would take time away from my kids and my family. And I remember when I was little, or when my kids were little, I have two, and asked them, like, I'm the doctor checklist. So I made a checklist to say, their names Ethan and Emma, what could I do to be a better dad? And I want you to answer honestly. And it was crushing, because they didn't care if I wrote more papers, or was in the news. What they say is like, play with me more. When you come home, get off your phone, roll around on the ground, get muddy with us. Like, and it was that moment. And I started doing that every week on Sunday. I'd say, tell me how give me a score as the dad, and what can I do to be better? It transformed me to say that happiness and our effectiveness is driven so much more when we have an internal focus of control than rather turning into all that noise. Like, in other words, like, what's
Hmm.
meaningful? Meaningful for me is having an impact, right? And there's other stuff, papers, like, yeah, okay, if they happen, fine, great. But when you could reframe your source of power and peace and comfort and joy is within you, and you have that control, it's so freeing to think, okay, I don't have to, like, go say something, on X or whatever is to get validated. Like, I'm validated because I'm human. And
Hmm.
and again, seeing that, because if whether it's all the great religious teachings, or Buddhism, or the mystics or poets, every one of them have this common sense of there's energy within and between all of us, and some all things, right? And so I have that energy in me. And just even sometimes, Adam, I'll do this beautiful exercise where I'll go walk, uh, sometimes in nature, sometimes in crowded areas. And when I see people or things, what I just see is, could I try to see their soul? Like, just what's good
Wow.
about them, right? And
Wow.
it's so energizing, as opposed to
Wow.
seeing, like, you're dirty, right? Or you don't dress well, or whatever, like, or you drive an expensive car. Forget the external thing. Just saying, when I see someone, like, what do I see? Do I just see a
Wow.
human being who has capability? And when I started bringing that to my work, to say, okay, the teams in our hospital, they're brilliant and beautiful. Like, just see them as good and unleash.
Yeah, that I love. I'm gonna try that, Peter. I really love that, and I think so many times, and I'm guilty, right? We live it. We're overstimulated and always on the go, and we can be reactive where we see somebody who's doing something, and kind of like what you mentioned before, we view it as to us. Somebody honks at you and cuts you off on the road, and I've been guilty of that, of allowing that to steal my energy in that moment, as opposed to what you're saying, see the soul of the person. It's so beautifully said. It reminds me of one of the recent guests we had, Dr. Susie Bentley. She, a lot of what you're sharing, she shared in a different way. She's been at Elmhurst, NYC Elmhurst for many, many years. Started a program called Helping Healers Heal. And she's an ER physician, and she talked about it. And again, as somebody who's not been immersed in that world, I'm very naive to it. I didn't realize that, in the ER, particularly, patients can hit physicians, patients can hit
Right.
nurses, et cetera. And I said, how do you continue to care for somebody who is, kind of against you, if you will? And I'm not going to go into her response or interview, but I'm wondering, Peter, when you experience somebody in medicine, I know you're not necessarily in the trenches on the front lines anymore, you're leading from afar, but when you had previously or see your colleagues experience it now, or in your personal life, when people maybe don't treat you with the same grace that you're wanting to deploy to them, what do you do in those moments?
Yeah. So, a couple of things in the, um, less acute. I draw upon this story from the Dalai Lama when he was asked, "How do you keep happy when someone's really annoying you, right? Like honking you?" And I use it all the time. He said, "I pause and I thank them for teaching me patience." Right. And so be careful if you use. I share this with my daughter, and now most of the time she'll say, "Dad, you're teaching me patience."
I love that.
But I also draw. wisdom, and I share a story from a quote from Plato that says, "Be kind to others, for they have a battle going on." Right? And I'm a
Hmm.
critical care doc, and Adam, I can't tell you the number of times um, people would come in and they're angry or yelling, and 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 we need to show empathy for that. And when I have these people, I use this technique that I call ALEEN, ALEEN, to address it. And first is I anticipate and say they're going to attack me, but this isn't about my ego. It's about what's upsetting them. Because normally our knee jerk reaction is defend. I'm a good doc. What are you talking about? The first, and then I just listen. Help me understand why you're upset. Because when you're upset, speaking is like oxygen. And if people can't speak, they suffocate. But most docs let people speak for like 3 seconds before they interrupt them. And uh, and then I empathize and say, I understand. I mean, like, and Adam, real stuff. Like a woman was really angry at our care team, and it turns out, her dad had surgery and had a lot of complications, and he went to another hospital that told him he couldn't have this surgery done laparoscopically. She wanted it done laparoscopically. It was taking a spleen out. We did it laparoscopically, and it was probably too big, and she had a lot of complications. So she, was probably feeling guilt or angry, or another family, because we forget how many people suffer. The daughter of a sick elderly woman, had a job that didn't give her time off, so she was taking 3 buses and didn't have a car to get to the hospital. Many hospitals aren't on bus lines, which is a public health issue that needs to change, right? But so she's literally coming in stressed. She had to find a neighbor to try to care for her kids. She hadn't eaten. She doesn't know how her kids are going to eat. She worries like her mom's, uh, dying. She's getting different information from the doctors and nurses, and she just needed grace. I mean, like, she just said, like, Plato has this beautiful quote that says, "Be kind to others, for they have a battle going on." All right, but we all have battles. So then we typically explain what we're thinking. Like, we're not crazy. There's a rationale. We may be naive, but the last part, N, is most important. It's co-create or negotiate the path forward together. Right. Again, this
Hmm.
idea of building trust that I'm doing with. And so all these things are okay. I understand you're upset. And here's your let's help us how we could solve this together. What do you have needs? What do we need medically? And I'm confident that together we could figure out something that's best for you and your loved one.
Yeah, you're giving me so much information here, Peter. I'm gonna have to go back and rewatch. I like personally acronyms are helpful for me because I can remember in real time. So to confirm, it's ALEE or ALAALEN. Was that
Just
it?
ALEEN.
Okay,
Anticipate,
ALEN.
listen, empathize,
Empathize.
explain, negotiate.
Okay, I love that. And going back to the imposter syndrome, I'm glad you brought that up, Peter, because I think most people deal with that, and it's something that comes up in a lot of these conversations. As somebody who has, been deemed, I think it was 2008, when you were named one of the top 100 influential people in the world. That's a big title. I'm sure in those moments, people are saying, "Wow, you can solve everything." What do you recall of your mindset after? Did you operate in the world feeling like a fraud of sorts? Were you like me? I'm the one. And if so, and even if not, how did you continue to push the boundaries? Because I think performance can be hard to replicate. You think about some of the top athletes, they have their best game, and then the next game, they don't always perform quite as well. And I'd just be curious of what you recall, like was going your self-dialogue after particularly that award or recognition.
Yeah. So, that uh, was quite, humbling in the imposter system, because the list was like the Pope, the leader of China, the leader of Russia. I mean, and there's a dinner for the winners at Rockefeller Center. So you're walking in, and I mean, just like, really, really, like, amazing, amazing, people there. Like we walked into the dinner, and Mariah Carey won for some, I think, some philanthropy or charity work she did, and she just starts singing on her own. Like, it was really, really cool. So what it did for me mostly, Adam, is in part a responsibility to continue to work to solve problems. Um, and I, um, live with a deep belief that the biggest problem the world faces, healthcare faces also, is our inability to solve complex problems collaboratively. And the number one reason is a lack of love. Or in other words, we separate, we discount others because they don't have a degree or they stutter like I do, or they don't, have a fancy title. And we destroy value and we demean people. But when you leverage that power, like you just unleash energy, as you saw that we did at UH. And so my whole career is, no matter what I'm doing, I'm always thinking scale. So like this
Mhm.
living and leading with love, we're already saying, okay, the proof points are breathtaking. It should be a model for the country or the world to go. Just like the checklist thing, was, in the US and, I don't know, 15 other countries. And so again, and when you keep an internal locus of control that says those things are kind of nice, but the real reward is knowing you're making, like, the internal satisfaction of having purpose in life. And
Mhm.
and I, have uh, believed that careers are kind of defined very simply by what I call the three M's: meaning, money, and minutes, which is kind of free time, right? And money you can substitute for fame. It's no external recognition, and there's no right combination, but there's a right combination for you, or at least at this time in your life. Those priorities may change, but if you're out of your sync with your soul, you're miserable, right? I mean, I can't tell you how many
Yeah.
friends I have who made a lot of money in banking or, in finance. They're 50 years old and they're like, okay, Peter, I made money for rich people. Like I'm rudderless. Like, what am I going to do? And for me, meaning is really, really important. Like, I believe I have some strengths and superpowers. We all have superpowers or
Yes.
capabilities that I do well, that I try to make sure that I leverage to do good. And um,
I love that. Yeah, and for people listening, I also wrote that down: meaning, money, and minutes. For people listening who might feel like they don't have a meaning, I agree with you, Peter. I believe we all have a purpose that's innate in us that sometimes fear will restrict us from taking action on. But how did you come to this realization that you can utilize your superpowers to do good? What was there a process that you went through? As a checklist, doc? Did you ask yourself tough questions, or you just immerse yourself in a week-long retreat? Was there any process? If not, what's your recommendation to somebody who's feeling purposeless in their life today?
yeah, so Adam, really, really good question. And at least for me, and I would say for most people, it's um, a journey that evolves over time. Where, I mentioned that imposter syndrome. So it's like at many, many times I would face a challenge and I worried if I can do it. And then I figured out, wow, we could, like, not only do it, I could hit it out of the park. And then get a different challenge or a bigger challenge and say, okay, I can't do this. Like, what am I thinking? And then realize, oh, wow, like it actually works. So some of it is getting comfortable to discover your own superpowers, that we all have them. And one of the things I did, Adam, that was really, really powerful in helping me to get comfortable with this. One of the awards I was getting, I had to give a talk about my journey. Like much like you're asking, but in a kind of more cohesive way. And I used the narrative arc of the hero's journey. It's a classic story. I mean, every Disney and Pixar movie is somebody who has doubt, and they have to leave home and they get a challenge and they often fail, and then they come out with a little wiser perhaps, and there's a villain and they get duped and they learn something more, and they end up with like kind of finding the golden elixir, the fountain of youth, and then they go back and bring it to their community, right? And it was so eye-opening for me to put those steps, like my father's death, like that med school doctor who said, "Why should I let you in?" But then he showed compassion, and I think perhaps each of you, your listeners, see their life through the lens of the hero journey, and tell their own story, because I think it'll help clarify where is your superpower and what gives you meaning. So then you could
Mhm.
focus on doing where you get meaning. It's funny you're asking this, because just today I asked, there's many people, but I asked 10 of the people who report into me, who I work with closely, who've made this leadership transformation journey, like the one where they like see souls, right? They see people as good and worthy and capable. They lead large scale change in my organization, and they get like unbelievable results, right? So they've done it repeatedly. And so I literally just sent them the outline of the hero's journey and say, okay, I want to interview on my podcast to say, tell me your journey, and don't
Mhm.
make it mine, because yours is more beautiful. Make it yours. So like people can see what's it like to go through this, and they're messy and majestic at the same time.
Wonderful advice. I want to be mindful of our time because I think I mentioned to you an hour. Are you still good for it? Looks like we got some questions. You good for 5 more minutes, Peter?
Sure am. Yep.
Okay, wonderful. Thank you. There were a few comments that came in, so bear with me just one moment. Very inspiring leadership style. Thank you for sharing, Doctor and Adam. Thank you for always having the best guest speakers on. I have to go for now. Compassion and love for the world. I love that, Doctor. Um, Doctor, love your energy. What happens? Here's a question. I think this is applicable, especially your work with culture. Um, the guest says, love your energy. What happens if a culture doesn't promote team members to associate their work to a higher purpose?
Yeah. So great question. And many organizations don't do that. I mean, many organizations are profit first, and purpose is silent. I mean that I there's pretty compelling data that when you put purpose first, profits follow. Again, because people are energized in this. But if you put profits first, you often don't drive it. And so I would encourage you to say again, we all create culture, and you have the ability to change culture. So perhaps go to your manager or your leaders, whoever is above you, and have a conversation about maybe by asking a question. I often find leadership is most effective when you seek to understand, to say, do you think we're connected to purpose here? Are you feeling connected to purpose? And I, what would be different if we were? Like
Mm,
how do you think we would perform better? Because when I look at the literature, I see like when organizations are connected to purpose, they thrive. I mean, they perform 40, 50, 60% better. Energy is higher. People are more joyful. And I wonder if we might explore how we could do that together.
mhm. I hear a recurring theme from you from the that there's like this power in questions and it's insightful. It's an encouraging reminder to me and hopefully our listeners that when you frame questions in the right way, without an agenda, you can get some powerful responses. So
Right.
thank you for that reminder, Peter.
Adam, I'll just say that, like, just because you hit on something. When I think about the values or the principles that drive excellence or this work, there's kind of three sets of them. The first set is the most important, and that is I am humble, curious, and compassionate. I respect, appreciate, and help others, and I am accountable to continuously improve myself, my organization, and my community. Right. But those
Mm,
first three, if you don't have those, you will not be excellent. Right. Because if you think you
mm,
always, so questions just follow from those values. Right. I'm
mm.
humble. I don't have the answers. I got to find them. I'm curious to see Adam. Like, and all people, you're smart. Love to see what you're going to learn. And then compassionate both for ourselves when we stumble and for others when they do.
So, my goodness, I could talk to you forever. I hope our paths cross in person. This has been an amazing conversation. I'd love to close with some hope and optimism with just one last question. I think, and in your world, you've probably seen it throughout your whole career. I don't know the actual, completion of suicide rates in medicine anymore, but obviously after COVID, that rose, and generally speaking, and in the general population. And hope is so powerful, in my opinion. You've kind of quantify love to some extent, and I we don't have enough time remaining because I'm betting we can probably quantify hope, and because I've always talked about hope as being something that can get us through difficulty, yet it's not tangible. But I do think encouraging words, inspiring words can be the hope and the catalyst to allow people to get through what they're going through. And for listeners today who might be feeling hopeless, Peter, those who are dealing with an illness, those who might be facing their own imposter syndrome, those who might have just gotten a flat tire or going through a divorce, whatever it may be, they're hearing all this great information from you, yet they're still not sure how to take that next step to get through their challenge. What's your
Mhm.
message to that person?
Yeah, Adam, beautiful question. It is to go make a micro moment. And let me explain what I mean by that. Barbara Friedrichsen, a psychologist, studies the biology of love, what makes oxytocin, the nursing or the snuggle hormone go up. And she found that oxytocin spikes or love exists in these micro moments of positive connection. A moment, I think, Adam, like we're having, I feel warm towards you, you feel warm towards me, and we create energy. We both are elevated, literally like this third dimension, not power, not closeness, but elevation to purpose. And these micro moments are contagious. They literally, if you put a positive person in a room, everyone else is likely to be positive. So, Adam, very briefly, I'll close with a story where I learned about the power of these micro moments to infect love. And it was in a Dunkin' Donuts. And I was buying bagels for the staff who worked on the ICU on a Sunday morning just before Valentine's Day. And the Dunkin' Donuts sits across the street from a bail bond and around the corner from a homeless shelter. So it's half homeless people staying warm, half people going to their job on Sunday morning. And I'm in line, and there's a homeless couple in front of me, and they're dirty, but deeply in love. And they wanted to see if they had enough change to buy the pink frosted heart-shaped donut that Dunkin' Donuts has as Valentine's. Some of you may have had it, and they were a nickel short. So the woman turns around and says, "Could you give us a nickel?" And I said, I'm getting an order for work. Just order what you want for breakfast. Tell them to um, put it on my tab. So they go up to the order and talk about lack of love. The cashier says out loud, "You can't order food. You people don't have any money." And
Mm.
the guy gets embarrassed and he says, "No, the guy behind me is buying me breakfast. The guy's sitting here buying me breakfast." I said, "Yes, I'll say I'm buying breakfast. Don't make a scene. Let them get what they want." Well, as a nurse standing next to me looks at me and says, "Huh, that's a cool idea." Turns to the homeless person next to her and says, "Can I buy you breakfast?" There was a Sunday school teacher on the other side of me who turned to the homeless person near her and said, "Can I buy you breakfast?" There was a cop behind me who did the same thing. This love cascade went 7 people deep. I was so blown away at the power of these micro moments. And I was walking out, and the homeless couple was sitting there having breakfast. And the guy said, "Could I speak with you for a minute?" And I said, "Of course." And he said, "We're not nobodies. We just made mistakes in our life, right?" And I think having self-compassion, I said, like we've all made mistakes. I've made my share, but I'm so confident that you're going to get your act together. Do me a favor. When you do, buy somebody breakfast. So slept forward to June. I go into Dunkin' Donuts on another Sunday morning. The cashier says, "Hey, Doc, some guy left this note for you." And written in a little crinkled paper was a note that said, "I bought somebody breakfast." So my friends, this may sound daunting, but what I would encourage you to do is go create one of those micro moments because it's elevating for you, but it's elevating for them too. It's like you're
Mhm.
bringing energy and love into the world that makes you both better. And sometimes it's just a simple act of kindness, like a smile to a
Yes.
homeless person that asks you for some change, right? Or listening to a friend who is suffering, or you asking someone to listen to your troubles and having the grace that they give you that pleasure. So, if for those of you, go make a micro moment today. Thank you,
Micro
Adam.
moments. Thank you, Peter. You were unbelievable. Deeply grateful for you, humbled by your words, and so thankful for your time and energy and passion you brought today. I'll follow up with you offline, but again, so grateful for you. I wish you good luck in all that you continue to do in the world beyond medicine. And for those that have stayed with us to this point, thank you for being here. I'll close at this time. But again, Peter, thank you so much.
Yeah, thank you. Have a great
You too.